Hi, my name is Fromm. I'm a Chinese medicine practitioner. I've been practicing Chinese medicine for almost 20 years now. I've been working inside a medical ward inside a hospital for the last 17 years, mostly in the orthopedic department in the Asafa Hospital. I'm the academic director of Friedman College, which is the four-year program of Chinese medicine for students. I'm in charge of the whole four-year program, and I'm one of the founder of the Israeli Ton Center. These days I practice Chinese medicine. I treat people in one of my clinics, and I teach a lot of the Chinese medicine all over the world. My method about the balance method and master Tan specialities. When I practice my Chinese medicine, I normally use acupuncture and herbal medicine and some nutrition. But when you come to me, you will probably get acupuncture and herbal medicine. The way I see Chinese medicine today is, let's say, not an alternative to Western medicine, but rather a challenge to Western medicine. A lot of the times, Western medicine focusing themselves on anatomy, they find that if they don't see what's wrong with you on x-rays or on your blood test, then they just tell you that something is wrong. Too many times I've witnessed sitting with doctors, a patient coming with severe pain and his x-rays looking rather well, and the doctor is just telling him, well, there's nothing wrong with you. Well, obviously there is something wrong with him, because otherwise he wouldn't suffer from pain. In Chinese medicine, it's looking at the world completely differently, focusing her view on the flow of blood and the flow of energy inside your body. We believe that if you stimulate the body properly, it will fix itself, and this is why the Chinese medicine and the acupuncture today looks a lot more like a therapy. You do one stimulation and then the body reacts, and then you have to do another stimulation and it reacts again. The more chronic your problem is, you'll probably need a little bit more treatment, and the more acute your problem is, you'll probably need less treatments. But you have to also understand that you're not coming to a one-session treatment. Rather, like physical therapy, you're coming for a series of treatment, and in this treatment I gently stimulate your body with very thin needles, and your body reacts to my stimulation and it heals itself. What I was specialized in is two major things. One is orthopedic and pain, and the second is internal medicine, both which I'm giving a long-term internship inside a hospital. You probably ask yourself, what is so special about Chinese medicine and orthopedic, for example? How can my acupuncture help like a simple orthopedic disorder like osteoarthritis of the knee? So any kind of orthopedic disorder, we can divide it into three. A lot of the time, the first thing is the pain. If you have some sort of arthritis in your knee, you suffer from pain. Pain is mostly what brings people into the clinic. The second thing is the inflammation. A lot of the time, within the orthopedic disorder, there is inflammation going on. And the third is the mechanical pressure on the nerve, because we are not just a biological creature, we also have mechanical and engineering within us. Well, acupuncture has been proven to reduce pain. We normally think about pain as just a symptom that shows us that something is wrong, but in these days of age, we know that pain is not just a symptom, but rather a general process of the disease, which means that the more pain I have, the more inflammation I have. If I reduce the pain, then I also reduce the inflammation. When I reduce the inflammation, I reduce the mechanical pressure on the nerve, and then I allow the body to heal. The body uses the inflammation as a healing mechanism. The problem is that this healing mechanism doesn't have its balancing, rather only by biology. So the inflammation in the body doesn't have a balance of uh, how much inflammation should the body do for each and every individual problem. So a lot of the time we have small problems, but we have a lot of inflammation going on. Reducing the pain reduces the inflammation. We also proven, and you can see it in studies, that acupuncture reduces inflammation by creating a non-inflammatory environment within the affected joint. Doing these two and stimulating the blood flow to the area affected also reduces the biological and mechanical pressure and allows the body to heal. Now, my second specialty is internal medicine. Then you have to ask yourself, how come acupuncture or Chinese medicine can help my internal medicine? Well, first, we're basing our medicine on signs, symptoms, and experience. It's not like that we have a point that reduces headache and a point that reduces stomachache and a point for diarrhea and a point for constipation. It doesn't work like that. It's rather that we do a full diagnosis and we are looking at the body as a whole. We're looking at the whole person and we're trying to understand what made his problem wrong. What made the body go out of balance? If you look on all the internal medicine within your body, there is only one common ground that you can share with them all. Every single internal medicine problems show a change in the blood flow to the affected area. Chinese medicine, as I mentioned before, focusing on flow can fix the flow to the affected area, and then the body can heal itself. And then it doesn't matter if you have diarrhea, constipation, you have breath disorder, you have allergies. Every single disease has the same common ground of affecting the flow of the body. Changing the flow within your body can change a lot of things and bring your body into balance. And as I mentioned before, the longer the disease is in your body, sometimes it's harder to take it out. So you have to also understand about that. Every single time you come to me, the first session, I'm asking myself two questions. The first question is whether or not Chinese medicine is valid to you, particularly to you and your disease. And only after I'm answering the first question with a yes answer, then I'm performing the first treatment. After performing the first treatment, I'm sitting with the patient and sitting with you, and we're planning how many treatments do you need to do in order to improve the situation much better. There's not 100% guarantee for success. Anybody saying that there is 100% guarantee is probably a charlatan. But we do have a lot of good results. In order for you to understand if the practitioner that you're meeting is a serious person, you just need to ask him, how many treatments will I need to do in order to feel well? And again, ask him where did he study and what is his education and experience. Doing these two simple things can tell you if the practitioner is qualified enough to treat you. I hope to see you all in one of my clinics. If you have any questions about Chinese medicine and whether or not it can help you, you can just contact us, and I hope to see you all soon, and I bless you with good health. Thank you very much.